So, good afternoon, everyone. And this is an amazing day and an amazing session that I'm going to have with you all. I'm waiting for a few more people to join, and I'm so happy that more and more people are joining us in this session. So, how are you all doing? I'm sure you all are at your home, and I am same. I'm at home, and I'm talking to all of you. Uh, Thank you so much, Brinton, for this wonderful opportunity. Really, thanks to the technology that we all are sitting at our homes and we can talk. So, good afternoon, everyone. Let me first introduce myself. I am Dr. Pallavi Sule. I am a dermatologist and aesthetic physician. I practice in Mumbai at Nahar Medical Center. And I'm so happy and glad to talk about the most critical topic about the COVID-19 crisis that we all are going through. This is the most difficult time that we are seeing. And the first time in our life, it is very important to be at home, to be safe, and not working. So I'm sure you all will agree to this. So yes, we all know that from so many days we are hearing about COVID-19 virus, coronavirus, we should do this, that, stay at home, not go out. And we all are still seeing so many active cases, and there are still few people who need to follow the protocols which are being set. So what is exactly this coronavirus? So coronavirus always existed, and the virus which is affecting people now is a novel coronavirus. So that is why COVID-19 is the term which is given to this. Basically, this affects our respiratory system. So like any other flu, the symptoms are similar to a common flu, that is fever, sore throat, and typically coughing. This, in severe cases, it is affecting the lungs. So people are uh, getting acute respiratory distress, that is difficulty in breathing as well. So in such conditions, wherein a patient is showing symptoms, they must report it to the medical practitioner and get themselves tested for the same. So I would request everyone to just start with their questions. I'll just check, and by the time the questions are coming up, I would also start our discussion for the day. So good afternoon to everyone. Anjali, Anita, Bhavesh, Shri Kumar. Yes, good afternoon, good afternoon. Okay, so Preeti has come up with the first question. What's the community spread? So by this, Preeti, I think we should go into a deeper discussion of how this virus is spreading and how can we prevent it. So basically what happens is a person suffering from an infection with coronavirus will have symptoms of coughing, sneezing, and they might be subclinical or they might be asymptomatic. They will not show all the symptoms together. So they are shedding this virus via two things, that is the droplet, and this droplet when gets on objects, it is the fomite. So what we have to take care is, this is a droplet infection. So whenever anybody infected with the virus will sneeze, the sneeze will go up to almost 2 meters or 6 feet distance, and because of which we have to maintain a social distancing of 6 feet between the two people, which we strictly should follow now. And if it's on any object like your hands, clothes, mobile phone, which is most common that we handle, the metal buttons or metal objects, your home switchboards and floor, your own clothes, your wash basin, sink. So all these places can also get infected, and every place will have their own liability. So the virus is liable on these surfaces for a few hours. So for example, on your hands, it is for 5 to 10 minutes. On the fabric that you're wearing, it would be for 2 to 3 hours. In the air, it would be for 2 to 3 hours. What I mean to say is that when you sneeze, surrounding area can be infected for another 2 to 3 hours. The metal buttons or metal objects like handles, buckles, it can stay up to hours together. So the incubation period is from 3 days to 14 days. Mean incubation is almost 7 days. So anybody who is not symptomatic can become symptomatic within next 7 to 14 days. And that is why we are observing quarantine for the people who have traveled to such places wherein already the activity of coronavirus was there. Next, what I come is to, so yes, the pretty, I hope community spread we have understood right now. So any place that we are going to, it might have infection. So when you're out, very important, first thing is to wear a mask. Now, why you have to also wear a mask? Since it is now quite widespread, you wear a mask to protect yourself from touching the face. So generally the mask is there and you touch your nose and mouth, then it is fine. But if you do not have the mask and you touch your nose and mouth, you can get easily infected. So what you do is you can put a normal mask or tie a handkerchief. This virus is a little big, so it cannot cross your handkerchief or your normal mask, what blue colored, what we get, the surgical mask. The N95 mask is supposed to be used by people who are already infected or sick, or by healthcare professionals, or people who are dealing with such kind of patients, like doctors or the hospital employees, and now I can say even the policemen as well. So you have to take care of these things. So when you come back home, yes, so there is a question which I will take next is, are we actually into community spread stage? Yes, definitely, Mangesh, we are into a community spread stage wherein now I think almost everyone either will be a carrier of the infection or will suffer from the infection if we do not observe a quarantine. So this 21 days of lockdown is for the quarantine, and this is going to help us staying back at home and not getting exposed. So what I say is only one person from the family who is in the age group of 30 to say 45, 50, if you have people in that age group in your house, do not allow the children below 10 and the elderly above 60 to venture out or go out for small things. So basically these people go out, you wear the same clothes always when you go out. You carry a small purse or a small wallet wherein you're going to use only that money or that card for all your transactions. When you come back home, you have to actually go and straight take a shower. Your clothes can be washed in hot water, Dettol and soap, and whatever objects you have taken out, like your keychain or your car keys, the metal coins and everything, you have to sanitize them with a sanitizer which is alcohol based and contains at least 70% of alcohol. So you disinfect everything. Now, whatever you get from the grocery shop, also those plastic met also have the virus on it because it stays for almost 7 to 12 hours on the plastic. So you nicely wipe it with Dettol water, diluted Dettol water and a cloth, and let it dry and let it remain for that out for some time, and then you can store it however you want to. So yes, we are entering the community spread, which is why self quarantine and self isolation is very important. Kavita is asking us, what about lack of sunlight exposure? Yes, Kavita, right now, when we talk about building up our own immunity, it is very important that we get sunlight exposure, but uh, due to the quarantine, we have to be at home. So, what I would suggest is instead of depending upon the sunlight for all your vitamin D3, you can start with vitamin D supplements and multivitamin supplements as well. So vitamin D3, 60,000 international units taken once a week for at least 4 to 6 weeks is good enough to pep up your vitamin D levels, and which will indirectly increase your immunity as well. So everyone, good afternoon, and I'm so happy that so many people have joined us in this discussion. Praveen is asking a very interesting question. When temperature raises, COVID-19 will vanish. Right now, so when I got this topic, I read about the virus more because this virus is very funny. It is mutating continuously. Initially it was behaving differently and now it has mutated. So even the temperature, it's a question mark whether temperature will really make a difference to it. They said that it is heat labile, so it will break down at 25 degrees centigrade. That is why we are supposed to drink warm water. I would suggest we continue to do the home remedies that we were doing. But right now, I'm not very sure of how it will behave at these temperatures, and will it really vanish off with hot weather and humidity? It is still a question mark, but yes, on the WHO website, there is more information on this, which they keep on updating. And yes, to 25 degrees is what we are saying, but right now, as the temperature is raising, even we are finding more and more cases. So, right now, this is still a question mark for me as well. Uh, So, ma'am, within Purushottama is asking, ma'am, within 3 to 4 feet, this virus will travel through hair. Yes. So what I have said is it can travel to 2 meters to 6 feet. So anybody sneezes, surrounding 6 feet is infected. So you must take care that either the infected person is wearing the mask, or if you are in public and people are sneezing, you have to ask them to either keep a handkerchief on their face or a disposable tissue, whatever they can get through, or if nothing is available, sneeze in your elbow. Sneeze like this. It is very important that a person who's sneezing does not spread the virus, and everyone holds themselves responsible for helping others not catch the virus. So it is very important that whenever anybody is sneezing, and if it is an open air, either you move away or the person thoughtfully sneezes into the elbows like this, so that it goes in the fabric and it is with the patient. They go home, change the clothes. Debojyoti is asking a very interesting question that, and this many of my friends, relatives also called me and they were panicking about this, that doctor, the hydroxychloroquine is not available right now at the medical stores. And I'm really surprised that why are we doing such panic buying? Because chloroquine, so Debojyoti is asking that chloroquine advised for healthcare professional, how an anti-parasite drug can affect doctors. So yes, this is a very interesting question. Now, chloroquine or hydroxychloroquine, this is basically they are anti-malarials and they are used to treat malaria. So it was found that a few people were, they were not affected by the virus when they were on this treatment. So this is still under um study. So it is not known that it is not a known cure or a preventive measure for the coronavirus infection. So what I would suggest is, please do not go and do such panic buying and do not consume this medicine if not told by by a doctor, because there are many incidences of people having liver toxicities and kidney toxicities with these kind of medications which are taken just over the counter. In India, we all know that all the medications are available over the counter. So I would request you people that hydroxychloroquine and chloroquine is still not a known preventive measure for coronavirus. What we know, what is in our hands, we are already doing it, and I would urge everyone to keep on doing it. So simple measures that you have to take is hand washing for 20 seconds. I would quickly give you the reason why 20 seconds. The virus is a two-layered structure. The inside is the genetic material and the outer layer is the fat layer. Now, when we wash our hands with a soap is an alkaline medium that will dissolve all the fats outside the genetic material and help the virus to break down. So that is why alkaline medium and the virus being an acid, it will break down the fatty layer and then destroy the virus. So 20 seconds of proper hand washing are to be done. Another thing is, when you wash your hands, you have to do some simple steps, like first wet your hands. Then I'll just put my hands up. First you wet your hands, then take some soap, and first we do like this for 10 times. After that we do like this for 5 times, another 5 times. Then we wash here between our digits nicely and our web spaces. Then is the thumb 5 times. Then our fingertips will also have germs, so you wash it like this 5 times. And then you rinse your hands and close the tap if you can with the elbow. If not, first you wipe your hands with a tissue and then you close the tap and throw away the tissue. So this is how you can wash your hands and the virus will not spread. Second is, do not touch your face continuously with your hands. So do not touch your face, mouth, nose with your hands continuously. Every 60 to 90 minutes, please go and wash your hands. We do not want ourselves to get infected, and so our family members also. And yes, we will continue with the other questions here because there are quite a few coming up. So yes, so Ajay is asking, hello Dr. Pallavi, why do they say not to smoke or drink when sitting at home? So basically, what the smoking and drinking will do is it will reduce your immunity, and definitely smoke is another toxin for the body. So we are increasing our toxicity, and especially if you're sitting at home and doing this as smoke, you are going to affect all the others as well. Smoking, alcohol is another thing which can cause liver damage if consumed more. And definitely, this is not the way to get out. And self quarantine is we develop more healthy habits. uh, Definitely, I know that it is very easy to get bored sitting at home for like 21 days. But yes, 21 days is a good time to cultivate a good habit, and you can do many things. You can learn many things. So it just takes 21 days to build a habit and to break a habit. So good habits is a thumbs up, and bad habits is a big no-no. And definitely, whatever will reduce your immunity, please don't do that. Imran Khan is asking, I'm having more than 4 times hot water. Is it good or not? Yes, hot water, as in lukewarm water, you can go on sipping. And if you're having 8 glasses, so 4 glasses can be of your hot water. Praveen is asking, is COVID-19 air transmission? If yes, preventive measures. No. So basically, it is not an airborne disease. It is a droplet infection. So it is not that if at all where I'm staying, only person who is having the virus can infect anybody up to 6 feet of the periphery. And especially if one person of the house is affected, the person should self quarantine from the others as well, especially the kids and the elderly. So they should stay back in one room, so that they do not keep on infecting the others. And yes, preventive measures we are discussing, hand washing is one, sneezing, coughing should be in the elbow, and whatever you touch, do like your metal things, you keep on disinfect. I am also going to tell you how to disinfect your house in a while. So let me take a few questions first. So Dilip is asking whether the masks are okay. So the masks, everyone is running out of stock. So do we really need those masks? No, Dilip, you do not need a mask in case you're an healthy individual and you have not traveled anywhere outside places wherever they are affected. So right now, everywhere it is affected. So I'm sure if you are healthy right now, you just need to cover your face with a handkerchief whenever you're going out, definitely. And that handkerchief has to be washed with warm water, Dettol and soap, and dried properly and then used again. Do not keep on reusing. The surgical mask, if you have any, then the blue ones which were easily available and now they are not. So just put them, but they are disposable. So once you use them, you have to throw them away. So Kamlesh is asking, can pets get affected with COVID-19? No. So dogs, cats, they are safe, so they cannot be affected. And Atish is asking, is it necessary to make distance at home as well within the family members? So it is a very tough question because staying in Mumbai kind of place, we do not have such big houses so that we can maintain that much of distance. But I would say that keep washing hands. Whenever you cough, sneeze, or do any such activities of touching face or anything, please go and hands. And washing hands is going to give you really dry skin, but I will give you a few tips for that as well. So, can we wash hands with salty water? Actually, not required soap or any sanitizer is good enough. So Mayuresh is asking why combination medications including antibacterial like azithromycin and augmentin are recommended as the first line of treatment for virus. So Mayuresh, I think so, to the best of my knowledge, at least we are not using any such things for viral treatment. Any physician you go to will definitely tell you that whenever you are having any symptoms of sore throat, cough, cold, or fever, let's treat it symptomatically. Let's do all home remedies like taking good steam or taking only paracetamol when required. So do not jump to antibiotics whenever you catch any infection. This is very one because if you keep on doing this, you will easily get immune to all the medications and your system will not respond to them. So initial 4 to 5 days is always given for your body for self recovery. Our body is an amazing system. If you ask it to self repair, it can. Now when do we give antibacterials is actually when we see that the symptoms are not getting better, the fever is not going down, you are getting more lethargic, fatigue, malaise is there, and if at all blood test done, then your blood test show raised blood counts, then we need to think about some antibacterials like azithromycin or augmentin. I hope this helps to solve your problem. Imran is okay. If Imran is asking, I am using sanitizer many times a day. Is that okay? So Imran, all sanitizers have alcohol in it, which is almost 60 to 70%, and they can give you dry skin or irritation or rash or anything. So what you do is always after using your sanitizers, just dry out your hands and whatever moisturizers available to you, you can use that on your hands right away. So Ajay is also asking us if we lock down for 14 days or even 29 days from here. That is almost a month we are looking at. Will the effect of total lockdown help us? So Ajay, it is a very nice question, but the beauty of lockdown is if everyone, all individuals on the earth understand what is self quarantine and not gathering up, because I am seeing some videos where people are actually going in groups together, and there is no reason. So yes, the total lockdown will definitely help. Basically, social distance and self quarantine. So in between, so just for an example, today morning I went for my groceries, and I'm standing outside the supermarket. We were given tokens, and we were asked, there were markings where we have to stand, but people took the token and they're standing anywhere they want to. They're sitting on the chairs, so you can infect all these places, and if you are not infecting, you might get infected with all these things. So people have to follow that they have to stand at a distance and not together. I understand, okay, from one family you can stand together because you have come together, but at least you keep a distance of 6 feet between two people who are going inside the store, grocery store. And please, guys, keep something for others. Do not buy everything for yourself, that nothing remains on the rack. That was really a very depressing scene today morning, that I saw that there are no biscuits available, there's no maida rava, nothing is available on the racks. Please do not do this. People need stores or sources in their house also. Think of others. Let's keep something on the rack for everyone. So you buy one or two packets, and then yeah, let's keep, because of the shutdown, things are not replenishing faster as they used to. So we have to keep in mind that all these things do matter. Another thing which I would also like to request, that if at all you're having elderly people in the house, or you know that in the building there are only senior citizens in a house, you can be very sweet to them, and you can go and get a few things for them, because small kids and the elderly are more susceptible to this kind of infection, and they can get the respiratory distress faster than anyone else, because the immune system is, in kids it is not built up, and in adults it is, in elderly especially, it is not functioning to the best of their body. So please help them out. um, Vijay is asking, vitamin C and zinc, it is good to improve immunity. Yes. So what all, I would just highlight a few points to improve your immunity. One is, you should have good amount of balanced diet. Then you should have vitamin C or citrus fruits every day. And I'm sure fruits, vegetables is not a problem at all. You can go and get them fresh, or you can get it delivered at home. There are many people who are doing it. Uh, Take a diet rich of antioxidants. What I mean by antioxidant in simple language, whatever has colored fruits, colored vegetables, you should take more of those. And yes, vitamin D, as I have already told, I'll just revise that vitamin D should be taken 60,000 international units once a week for at least 4 weeks. And if you've already taken it, you can take it once a month for next 6 months. Okay, so Anjali, very beautiful question that she is asking. As a layman, how can I understand the difference between the normal and the corona cold symptoms? It is very important to differentiate also. Now, what happens is, since this corona started, everyone is like, oh, I think I have a sore throat. Oh, I think I have this. I think I have that. So basically, and it is like symptoms start like any flu, but in corona, you will never ever have a running nose. So runny nose, if you have, you do not need to stress. You just do your home remedies of steam. You can take the herbal kadha, and you can make it at home also. So all these, there are cough syrups and all which are available, but I would suggest just go by the symptom. If you have very high fever, if the fever is spiking, it is not reducing, you start coughing, sneezing, or you're having difficulty in breathing, please report to doctor immediately. Get your swabs done and quarantine. That is very important. So I'm just checking for the last few questions that I will take. So yes, Manish is asking that what do you mean by staying behind the curve of the spread? Okay, so what is happening is now this infection is entered into the community. So what we will, by staying at home, we are trying to flatten the curve so that the transmission from person to person or fomite to person, that is object to person, is going to decrease. So we will be behind the curve. That is what I mean to say, that we will not, uh, as fast as this virus is spreading, we will not have so many active cases. And we should all know that when there are less active cases, we are on the better side. And I'm sure the lockdown is helping. So please spread the message of quarantine and self isolation with everyone you know. Yes, a very beautiful question, which I will take as my last question, is what tips for parenting? Now, I am a parent, and I myself I am facing very difficulty because kids are really very upset about the fact that they are not allowed to go to the school. And schools are shut. So first of all, they are not understanding that why suddenly the school is shut. Another thing is, they are they are free, so they want to do some activities. So definitely you can sit with them. You can ask, first of all, ask them that what activities you want to do. Let their interest be our interest. So you can play with them. You can do some craft with them. There are beautiful videos on YouTube for paper origami, that is paper craft, simple what we used to do. And also there are some nice videos on how to draw, and yes, definitely the cartoon videos and everything. And now that Ramayana and Mahabharata has also started playing on the television, you can also show them that when we were kids, we have grown up just watching this on Doordarshan. Another important thing, what I do with my family, every evening at 6 o'clock, we do some interesting activity. So be it Zumba, be it any physical activity like yoga, and we also meditate for 10 minutes, because I have observed that till 3 o'clock the day goes really well, and then further down it slows. And then even kids, it's with kids, but yes, even the parents also get a little upset. So I think evening time you can do these activities. You can have a singing session, or if your interest is in painting or any craft activity, so definitely you can do that with all the kids. Also, a very small tip for parenting who have small babies in their house: please wash your hands, wash your hands, wash your hands. That is, washing hands is very important. You washing your hands, others who are touching the baby washing their hands, is very important. Another thing, if there is any if anyone is coming for giving a massage to the baby or something, please ask them not to come. The mother can do it for the baby, and or anybody elderly in the house can do it for the baby, because it is observing hygiene right now is very important. Vaccinations, if any, can be postponed. When you can ask the pediatrician and postpone it. For those who are teenagers, please take care that they are, if they are on social media, then they are watching the right content. And yeah, so all these are very interesting things. Something that interests even my profession is, I would like to advise you what to do with your dry hands. So pick and choose your moisturizer, which is having mineral oil, petrolatum, and they are bland. They do not have any fragrance. They do not have parabens or anything. So you can just apply it on both the hands and uh, moisturize your hands every time you wash them. All right. So I'm just going through the questions in case I find something really interesting and important. I would. Yes. So Vishak is asking about palmoplantar psoriasis. So moisturizer right now. Me too, I have already discussed about immune system, how do we boost, so you can go back to the video and listen. Narayanan. Okay, so Bala is asking, do COVID-19 relapses? I really don't have an idea. I also have to do my homework for this. And I'm sure whenever I find the answer, I would write it in the comment section over here. Dilip is asking, do we have to maintain distance at home normally? No, I don't. See, we say that at least a 6 feet distance, but it is difficult in the houses. You can try to maintain as many as personal hygiene as possible. So washing hands. Karishma is asking any skincare tips when I'm at home. So yes, you can definitely catch up with me on a few videos since we are running out of time. Ritesh is again asking about HCQ medicines. So please do not just go and buy them. Please read about it, and definitely if your doctor suggests, only then. But as a medical professional, I would say that this is still into the pipeline. There is no proven data, so do not take this if your doctor has not recommended. Rajendra is asking about povidone iodine is a broad-spectrum antimicrobial and controlling infection. Yes, so disinfection was what I would want to speak a little bit about. Disinfect everything in the house. Switchboards, mobile phones, car keys, floor, restrooms, your sink, kitchen platforms, uh, wherever you sit regularly. So if you're sitting in a living room, your table has to be cleaned twice a day at least. And how do you disinfect? There are a few disinfecting agents like povidone iodine, how you have said. There are other cleaners, cleansers, which have disinfecting agents and they are approved, so you can use them. Another thing, is you can dilute bleach, so 1:4 times in water, and then clean your house with that. But be very careful with it. Tablet Septilin. So I'm just giving this question right now. So Ajit, there are no blood tests. You can just go for a nasal swab test. Yes, Ritesh is a pharmacist and he sanitizes hands after every patient. So it hampers your skin definitely, but you can keep a moisturizer handy and keep on applying moisturizer because it's very important for you to not catch the infection. Dryness can be tackled anytime. Uh, Going for a walk in a society, and I do not really suggest that you should go out for a walk. Please stay at home. Yes, you can use sanitizers post your. So Ajoy is asking about animal parenting. So it does not spread to animals. It is from it is a zoonotic infection. Actually, it is from animals which has come to humans. But transmission from human to animals, especially the farm animals, doesn't happen. So still, I would say that you should take care of your sanity. So personal hygiene is very important. I think we are good with the questions. So whatever are there are very nice questions which are still there. I would like to answer them on the page itself, and just enumerating the 5 tips what I want to give you and what everyone would know. But still, I will revise it with you all. First is hand washing. So hand washing is very, 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 very important for 20 seconds. Second is sneezing, coughing, or any such activities. Please do it in the elbow, like this. So you have to do it in the elbow. Remember. Another thing, stay at home, stay safe. Your personal hygiene is very important. Do not. Fourth thing is do not touch your face again and again. Do not touch your face again and again, which is very, very important. And fifth point is quarantine and social distancing. So 6 feet is what you have to observe. I am very sure that this session was Good. And I thoroughly enjoyed it answering all your questions. I would like to thank Brinton for this opportunity. I always wanted to come on a social platform to talk about coronavirus because as a medical professional, I have lots to tell and lots to say, and I try to do it as much as possible. But this was a good social cause which I wanted to address. So, people, you have to stay at home, stay safe, maintain your personal hygiene. I know I'm stressing upon this a lot. It is very important in this difficult, trying hour, and everyone's support to this lockdown and to quarantine will help us to get out of the situation as soon as possible. So, happy staying at home, and I wish you all a healthy life ahead. Thank you so much. Bye bye.